Overall, violent crime rates in this region have been largely falling over the past couple of years, but more recently there have been several high-profile incidents carried out by young people, among them the pair of 13-year-old twins who were arrested last week for as many as 9 assaults around Boston over the past month, and the 5 teenagers facing assault charges after police say cell phone video showed them attacking a woman in downtown Crossing a few weeks back. Then there are the accusations of decades of sexual and physical abuse between students at the Mission Hill K-8 school that city officials voted to shut down last week. And not to mention a national report from Boston University researchers that found kids aged 12 to 17 are now 40% more likely to carry a handgun than they were 2 decades ago, although those numbers are lower here in Massachusetts. I'm joined by Ruth Zakarin, Executive Director of the Massachusetts Coalition to Prevent Gun Violence, and Jumaane Kendrick, Director of Programs and Partnerships at the Dorchester-based nonprofit Mission Safe. Welcome to both of you. I always want to make sure that we're careful here. We talk about statistics, we talk about some high-profile incidents, but I want to make sure that we're also presenting a full picture here of what we see as happening from the statistics sent to us. Jumaane, obviously, any violence in any neighborhood involve kids or adults. We don't want that happening, but there is a feeling that things have been somewhat safer for adults in some ways, and children are reacting in some ways to the obvious stressors that they have living in the environments that they are, social media, which is also having an impact, and of course the COVID pandemic. Can you tell me what your take on these numbers and these stories are that we just shared with the audience?
Absolutely. So you named a number of those things, COVID being one of them, where young people don't have access to these out of school programs. And then after school and then during those times of school, they don't have access because of the days and times of programs that are operating. COVID has made it in a way where this online learning has been a real big struggle. And so youth and students are not going into school on a daily basis and consistent basis, where they're finding themselves either skipping school or they're leaving school early, which is just giving all this idle time to be in places where they should not be, and get into things they should not get into. So COVID is definitely a big one, right? We have a lack of advocates and case managers on the streets because there's just not enough resources for those, right? You also have a huge issue around programs, community programs within the schools themselves. We don't have enough programs within the schools from the community. People don't speak about that enough, but what happens when you have young people and you have community resources within the school where they're working with them within the school, and when they leave the school, they are followed by those people and they're connected to the programs in the community. So when they leave, no matter what time, it could be 10 o'clock, it could be 2 o'clock, they find themselves in those safe places, these community resources, these community programs, after school programs, they find themselves there. And then just in addition, we have a diversion issue where when young people, juveniles are locked up, especially between those teenage ages, they are released based on the discretion of the courts for whatever laws that are put in place. But there's not a lot of diversion. There's strong diversion programs when you do have them, but we have so many young people, we need more. So diversion, COVID, lack of access to community resources, and then having community resources within the schools are some of the issues that we're seeing.
And Jumaane, to your point, before COVID hit us, we were seeing, at least in the Boston Public Schools viewpoint, where my kid went, there weren't enough guidance counselors. There aren't enough nurses. There weren't enough social workers that were involved in the schools before COVID to help children who are navigating difficult times, right?
Absolutely. I was actually working in BPS prior to coming over to Mission Safe as a director of programs. So I seen it from within BPS, and I seen that I could have more influence outside of it, catching them out there versus just in one school. So I thought that I could have a bigger engagement when I'm outside of the school to catch multiple areas where youth don't have anything going on. So yeah, it's a big issue.
Ruth, the good news here in Massachusetts is that hopefully our gun laws have been helping to keep guns out of the hands of everyone, especially children. And the bad news is that nationally those numbers don't show that. And the more bad news, if you will, is these ghost guns that folks have access to, that they can make guns, 3D guns that are going on unchecked. What has been your reaction to where we are with crime, especially when it comes to youths participating in violent incidents?
Yeah, thank you for the question. I think a lot about what does prevention mean? Because ultimately we don't want to just punish young people after something bad has happened. We want to engage in meaningful prevention to ensure that the violence, the traumatic incident doesn't happen at all. And to me, prevention is really about making sure that young people have what they need to be safe and well in the world, whether it's access to education, for youth jobs or safe recreation, and that we're investing in these programs, we're investing in young people to ensure that they do have the resources that they need to be safe and well in the world. So when I see these numbers, and the numbers went down for young people in Massachusetts, but as you mentioned, not nationally, what the question that comes up for me is, what else do we need to be doing? The adults in the room need to be doing to make sure that young people do have what they need to be safe and well in the world.
Jumaane, probably about 6 years ago, 5 or 6 years, I live in Roxbury, and about 5 or 6 years ago, there was a weapon discharge, a shooting. Nobody was hurt in Jamaica Plain. And I was out of my car at the time. It was the middle of the afternoon. Kids were getting out of school. There was a school bus right there with elementary school kids on the bus who, saw what happened, saw the police come, and I was shocked. I then called my city councilor, who took action, that happened to be Tito Jackson at the time, and said, who's making sure that these kids are going home to support services after seeing this violent incident? This would not be tolerated in Weston. This would not be tolerated in Sherburne or Dover. If there was an incident like this, there would be school counselors right there, and there was action taken. What do we need to do as a society to understand that when violence happens around our children, we need to make sure that they are getting the support both individually and as their families to make sure that they can process what's happening?
Well, the thinking that those things in the neighborhoods of Roxbury, Dorchester, Mattapan are normal is the problem. When you have violence in these communities as often as you do, it becomes somewhat of what they will say is normal, and that's the problem half the time. When we have these incidents and there's no debrief, there is no immediate follow-up with young people who witness these type of traumatic events, that's the problem in itself. And that falls on the adults. That's not the children. The adults are normalizing this or rationalizing it in a way where it's the child's fault. So therefore, they must have done something, or they are in an environment where this is okay. That is where we have the breakdown, right? So we need to change the mentality of that. When these things happen, what is our response? There's a small group of us that do have a response to it, and I commend those people where we're doing debriefings, we're providing one-on-one counseling, we're doing follow-up. We see what it looks like when a kid is traumatized, because it turns into fear, anxiety, and unsafeness. So we have to just have more people on the ground to be able to respond to these when these happen. There's just not enough of us. That's one of the biggest issues. Having a capacity issue is huge, right? But also doing things to change the society that we're living in infrastructurally wise, right? Like, we don't have the economic resources that we need to change why these young people got off the bus right there, and that there's nothing going on, and that there's idle situations where they can now shoot in front of a school bus. It came from a plethora of things of why there is all this time on their hands, why there's access to guns so easily, why do they not have value, or there is any value in their community or themselves to where they feel like this is okay. So there's a few things that need to change on the adult side to be able to perpetuate and model what the young people should be doing.
Ruth, I always think it's important. I'm a firm believer. I don't care who the person is. If, in my opinion, if you're under 18, 18 and under, and you're involved in a crime, you're a victim as much as whomever you happen to be victimizing in whatever way. That's Absolutely. My firm belief, regardless of what the crime is. And I'm always shocked at how we have in society such a sliding scale about depending on who that person is that committed the crime and if we're going to apply that that minor
Yep.
status to them, and it drives me absolutely crazy. I'm wondering, when it comes to reducing gun violence, are there ways that you are able to educate children and teens directly about gun safety, about gun laws, understanding how severe it is here, especially in Massachusetts, if you get caught breaking a gun law? What are some of the approaches that you're looking at to try and help reduce gun violence from an educational standpoint?
Yeah, and I think it's an important question. I appreciate your analysis around young people who have been impacted by violence. And I want to talk first about just a policy issue related to that, because we know that guns are coming into community in all sorts of ways, but we need to better understand that. And one of our legislative priorities is something called the Crime Gun Data Analysis Bill that would better analyze data collected from guns to understand how those guns are landing in communities, because we need to know that. We can't make good policy around how we address that unless we understand where that's coming from. And in terms of education for young people, so, one example is, and I just really appreciated the language around how violence becomes normalized, because we've been thinking a great deal about that. There's a documentary called This Ain't Normal about violence amongst Boston's youth. And we've been partnering with the makers of the documentary, Create a Buzz, to hold screenings of the documentary with panel discussions that involve young people, survivors of gun violence, frontline workers, folks who are formerly incarcerated, because we want to change the narrative around young people who have been impacted by violence. We want to talk with young people about the serious nature of this and also recognize that so much of this is based in trauma and not feeling safe in the world. And that when we come together and say, no, this isn't normal, we need to help young people feel safer in the world. We need to attend to their emotional needs, their concrete needs. That's how I think we're going to move the needle about gun violence.
Jumaane, I had a conversation with one of a kid who I was waiting at a bus stop with not long ago, and he was making some jokes about shooting. It was nothing serious, but I said to him, gunshots hurt a lot, and he didn't believe me. And it really struck me as one of these conversations, that we watch television. We all watch television. People get shot in the leg and they, run 8 miles, and we're not doing a very good job communicating the trauma that happens when somebody is shot. It's not just getting shot in the leg. And I'm just wondering, from your experience, what kind of conversations are you having with teens and youth about ways that they can be part of preventing violence and understanding that, there can be a new normal that will make all of us safer?
Well, I think that, as a person who has been a victim of violence and gunshot wound, and so it does hurt, right? So when I hear this all the time, they what they have not experienced, they cannot actually speak logically to. So that happens a lot, right? But what's happening and why they may have that mind frame is that the people that they are idolizing are glorifying some of these things: incarceration, committing acts of violence, being victimized, right? They are glorifying those things. But the actuality is, when they are injured or they're incarcerated, the story that is not being told is that the sleepless nights, the fear, the pain, the self-medication, right? Those things are happening. The loneliness, right? And so what we're doing is, one, we're giving them the actuality for them to actually become a person that they are idolizing, that normalizes expressing the pain and the heartbreak of the actual situations versus ignoring them and then only speaking on the so-called good parts of, what happens, right? When they see it from someone they idolize, then it's okay for them to speak about the hardships of what happens when you're injured or you're someone that is being peer pressured into gang activity, right? What we're doing now is that we're creating peer model, programming, so that they're going out and they're speaking the same thing to their peers, so that therefore it does not seem less than, or they are seen they're outcasted because what they're speaking is not cool, So we're trying to change what is cool. We're trying to change what the value is of speaking honestly about hardships and not, what did they say, hurting in silence, right?
Mm-hmm.
That's what's happening. We're trying to change that so therefore that they can lean on their sisters, brothers, peers, aunts, uncles in their community so that it's not something that they're going through by themselves, you know, and that's how we're looking at this because they're just idolizing people and they're repeating what they're doing, and those are mostly negative behaviors. And so we're just trying to change those by modeling positive
Well,
behavior.
I appreciate both of you for joining me and letting us take a look behind these headlines and hope to pay attention to kids and violence every day of the week, not just when it's in the news. Ruth Zakarin and Jumaane Kendrick, thank you both.
Thank you.
Thank you so much.